Dr. Ghaly, for you, sir.
Sure. Thank you, Governor, and really I want to echo Mayor Schaaf, the gratitude we have for your leadership, for being the wonderful partner in all of this hard work. I want to also acknowledge that we've spent time over the past 24 hours talking to our county health partners from the County of Alameda, really digging in this morning to these medical logistics, what is going to happen as the ship comes to port, how can we assure that the workers involved in bringing people off the ship are equipped with the most important and to fulfill guidelines with the CDC and state guidelines, the personal protective equipment, that we have all of the right questionnaires, that we get all of the information from the hasty teams that are going to be on the ship today, and that we're able to assimilate that information quickly to prioritize the passengers coming off the ship, ensuring that we keep exposure to those who might be positive or have symptoms low, and we get them to the right clinical services that they need immediately. This has implications, we know, to the city of Oakland, to the county of Alameda, and broadly across California. And as many of you know, we have been for weeks, months, preparing and escalating our response to COVID-19 across the state, preparing many labs across the state to be able to do testing, asking on a regular basis for supplies for testing from the CDC, having all of those requests fulfilled, ensuring that we're working hard with many of the health providers that stand behind me and across the state of California to ensure that for our increasing cases in the community, we are well prepared. I want to assure you that bringing this cruise ship to Oakland and Alameda is not going to absorb the precious resources that we have in place for testing. We've been working with the CDC and others to ensure that we have additional supplies arriving for anyone who does need to be tested from the cruise ship. Additionally, I'll reiterate what the governor mentioned, that as people leave the site of Oakland, move to Travis and other bases across California and potentially across the nation or to their home countries, that they will not be tested here, they will be tested there. That's important both from a supply issue, but also from a timing issue. We are not holding people at the Port of Oakland to wait for positive tests. They will find those results if they are indeed tested at a different location. I want to just thank, before turning it over to Dr. John Redd from our federal HHS partnership, and he will give you additional details about the logistics. I just want to assure you that we continue to sit down throughout the course of the day before we have the ship port to iron out all of the last most important fine details to ensure that staff are safe who are working in this site, and that anyone who's involved in transportation or caring for individuals coming off the ship have all of the details in advance, and that we can assure that they are that all of the procedures meet the highest clinical indicators at the moment. So with that, I want to invite Dr. John Redd to give you more details.